Hello, I'm Dr. Daryl Rich with Core Chiropractic and Wellness in downtown Roanoke. Today we're going to talk to you about IT band syndrome. If you're not familiar with that term, it's probably because you may not be a runner or a cyclist or you just have never had this type of pain. But for those who have had IT band syndrome, it is a memorable experience because it's one of those most painful kind of tendinitises that you can have, and they're very, very stubborn. And so today we're going to share with you some of our kind of tools and tips that we use around our office a lot to help fix this. The most common individuals who generally have this problem are long distance runners, cyclists, obviously triathletes will fall into that. But other people who sit and bend a lot, maybe like bend in the garden or they go up and down a lot of stairs, they can also really struggle with this type of overuse syndrome. And so today we were going to talk about this. So the IT band, it stands for iliotibial band. It's a fascial connection that is on the lateral side of the leg. It starts with the muscle called the tensor fascia lata at the top. And it comes down and it literally inserts just right above the fibula. That's the little bone below your knee. It inserts right through that connective tissue. And it becomes very, very irritated. And that's why it's called a syndrome, because it's an inflammation type of process. And so, unfortunately, a lot of the old school kind of ways of treating this, where we iced it, we rested, we foam rolled the IT band, we stretched the IT band. What we're finding is that those are not very helpful anymore. And so there's been some better techniques that have come around, and it really kind of goes around the idea that this is a weakness, it's an imbalance at the hip. So what ends up happening with a lot of these individuals, particularly let's take a runner for example, as they're running and they're in their one leg stance as they're running, maybe on a trail or they're running on the road, the glute medius muscles, the big hip muscles up around the hip here, the glute max and the glute medius, these muscles that are supposed to act as stabilizers start to fatigue. Obviously, if you're running long distances, those muscles have only amount of time that they can help to stabilize that hip. But as we push beyond that stability point, then the body starts to look for a compensation pattern. And that compensation pattern starts with the muscles that are typically found like in the groin, that adducts the leg, it stretches and puts extra tension and pressure on the IT band. And over time, that extra stress starts to produce scar tissue and we start to have this overloading mechanism. So today we want to show you are some exercises and some stretches to how to properly work on that hip and reestablish a good balance. And then we'll talk to you about some treatment options and some activity modifications and training modifications that can really help to reduce the overuse on the IT band. So we hope you enjoy this. So this stretch is a posterior capsule stretch for the hip. It works on the rotator, the little tiny muscles that surround the hip capsule. And with a lot of conditions where the hip becomes very stiff, this is a really great kind of dynamic stretch for it. I'm not a big fan of sometimes really hardcore like the static stretching, like bringing a knee to the chest or the typical pigeon stretch that a lot of people do, because it can overwhelm and kind of irritate those kind of delicate muscles in the posterior, the really deep part of the hip. So I really like this kind of more dynamic stretch for those little muscles. So particularly like in something like IT band syndrome, after you've stretched the groin, which is just a typical kind of standing, lunge stretch to the side, which really works on stretching that groin muscle, this is a great follow-up exercise to that. So let me just show you that kind of stretch. So what we're doing is we're going to get on lay on our side. I'm going to have you bend the knee and the knee and the hip to 90 degrees. And from here, from kind of a sitting position, we're simply going to kind of roll down onto our elbows and then come right back up. So it's a nice fluid motion. You're keeping the core nice and tight. And we're just allowing this movement to stretch those little rotator muscles in the posterior capsule of the hip. So again, you can just do this about 5 or 7 times, whatever you kind of feel like you need. If you need a little more stretch, you don't have to go on just your elbows. You can actually go all the way down onto the floor and just kind of keep moving back and forth. Don't stay in that stretch for more than just a couple of seconds. So we're not trying to to overwhelm those muscles. We just simply want to get some movement restored back to the posterior hip capsule. When we're talking about a lot of hip and knee problems, again, things like IT band syndrome, patellar tendonitis, trochanteric bursitis, there's a need to strengthen the hip muscles. Again, this imbalance that occurs where often the groin gets really tight, the G medius, the G max get very weak. It can overload the TFL, and it can create a problem when it comes to strength training, because typically we like to go back into that compensation pattern whenever we're stressing the hip. So it's important that we use exercises that really target the intended muscles. And so I want to go through a couple of my favorites that I like to show patients, and that way you can give them a shot at home and see what you think. So one of the classic ones is called the Clam Exercise. It's been around for a long time. It does work relatively quite well. You can, again, kind of in a sideline position. In this case, I'll be working the right hip. I'm going to have my feet together, slightly kind of bent in front of me is where my knees are going to be stacked upon each other. Try to be really strong and kind of long through the core so you stay really tall. Take my finger, I'm going to kind of poke on the ASIS, the little bone there in front part of the hip. Put my thumb into the soft tissue, and that's the G medius where your thumb lands. From here, it's just a small little motion, just allowing for the knee to kind of separate away from the other knee. And you'll feel that muscle underneath your thumb activate. That's the muscle we're trying to target, the G medius. What you don't want to do is you don't want to watch out for some trunk rotation. Sometimes people will try to kind of open up the knees that way. And we want to really isolate and just kind of keep that hip muscle just targeting the right one that we're looking for. You can also take a little band, like a TheraBand, looks like this, and you can wrap that around the knees, and that gives you a little bit of resistance training. That works really well. And again, so those exercises work great. They've been around for a long time, but I kind of like these a little bit better, so I'm going to show you a couple more here. So we talked about this rotation, the deep rotator stretch, where we're in this sideline position, hip is bent, the knee is bent, and we kind of move down onto the floor and then come back up. It's a great dynamic stretch, again, to loosen the hip up. Now, we can also use that same position to strength train. So in this case, what we're going to do is we're going to go back into that position, really long through the spine, try to keep really stabilized through your core. My hip, again, is bent at 90, my knee's bent at 90, and I'm going to raise the top leg into the air. And from here, I'm going to push my outside of my knee into the floor, and I'm going to lift my hips up and hold that for a couple seconds and let it back down. And again, come right back up and let it back down. And just do it for about 3 to maybe 5 repetitions. It really won't take long to really target those muscles. You'll find that those will get activated pretty fast and start a pretty fast burn. There's another exercise that I really like that kind of follows that same idea of working that downside hip. And this one involves a little bit of rotation. So we're going to kind of brace a little bit harder here. We're going to really try to make sure the hips and the shoulders move as kind of one unit, brace through your core musculature really, really well to very kind of work together with those hip stabilizers. This is a really great exercise. So again, you're going to be kind of back in that same sideline position, hand flat on the floor, knee is going to be bent, foot's going to be flat on the floor. We don't want to raise this foot up, so keep that one down. This leg is going to come up, and this is as if we're kind of rolling over like a baby does. So we're going to brace really tight through the core. We're going to come up in the air and slowly rotate and then come right back. And again, slowly rotate and come right back. And so we're just working on stabilization, getting even the shoulder involved with a little bit of hip stabilization, and using those core muscles to really fire strong. So try those. I think you'll find you'll really like those. They work the hip really, really well. You can do those every day if you're not getting too sore. Again, combined with some groin stretching, the hip capsule stretch, you'll be well on your way to rehabbing that hip. Take care. All right, so I've got a few just more tips for you here to help you manage this overuse syndrome, this IT band syndrome. We use these for a lot of our tendonitis, a lot of our overuse cases that we see. So this is applicable not just to IT band syndrome, but particularly for any other type of tendonitis, knee tendonitis, shoulder issues, elbow issues. These kind of tips can be kind of universal for that. So number one is that we see a lot of people just don't warm up properly. For our athletes, a lot of times they like to tie the shoes, just start off slow, and that creates the overloading mechanism because we have to warm up, not just blood flow, not just length of a muscle, but really the brain getting involved with that warm up, making sure that the stabilization pattern there is proper. So I would encourage you, if you don't have a good warm-up, go to our website, go to our YouTube page, and look for the video called Morning Mobility Routine. And this is a great exercise routine that you can use in the morning. It's good for the beginning of any other type of workout, run, cycle, swim. It's a good overall routine to get your big joints, your hips, your shoulders, your knees moving better, and it helps to activate the core stabilization muscles as well. I can't encourage you enough to use that video with practically every workout that you do. The other thing is, again, this is an overuse issue, so you've got to change the training load. All right, now a lot of times when people hear that, they can't imagine decreasing anything because they've got their race coming up, they've got the big event, they feel like they're going to set themselves back. But this is kind of one of those things where we're just going to pause, we're going to modify a few things to get you back to where you want to be at faster than if you just try to keep pushing through this pain. So one of the biggest things I tell patients is you have to decrease the distance. You have to decrease sometimes like the resistance as well. That'd be like hills particularly. But you may want to increase your pace, increase the speed. Particularly for runners, when we run, we use the glutes more with a faster run than we do like in a slow distance run. Distance running usually works the hamstrings more. Fast-paced sprinting works the glutes. And what are we trying to activate with IT band syndrome? We're trying to activate the glute. So decrease the distance, decrease the hills, or again, the resistance, so keep it more flat, increase the pace, increase the speed. All right, those are big keys. Another one would be is to watch for the icy or wet or kind of unstable surface. So around here, again, maybe running on some trails, it may be running out in the cold weather. You've got to be careful with that with IT band syndrome particularly because it overloads the front part of the knee too much with those types of conditions. Stay on firm pavement, stay on a good track if you can, not a real tight track because that circular motion will also create some IT band. So if you can kind of keep it flat, straight, stable surface, something like the Greenway, it works really, really well. You got to watch for that crossover gait. So for a lot of runners, particularly if you're running with a running partner, have them watch you or you watch them, and you want to make sure that they're tracking in kind of a good frontal plane position. You don't want to see them kind of bringing the hip up and over and around. It's common with a lot of hip weaknesses for that to have that type of gait pattern. So be careful of that. You want to make sure that they're running in a straight frontal plane. The other thing is for cyclists that's really important is watch your bike fit. Unfortunately, a lot of times we kind of fit the bike the first time we get it, and a few years have gone by. You've changed, the bike may have even changed, and if it's been a while and you're having some issues, particularly when you're on the bike from an overuse standpoint, it's a good idea to get to one of our local professionals around here and get fitted properly. Watch the toe-in position, particularly for the IT band syndrome. It creates a rotation of the tibia, brings the fibula along with it, that pulls on the IT band and really creates this overload that we're trying to avoid. For those of you who like to work out in the gym, the exercises like knee extensions, hamstring curls, even leg press, I hate those exercises. They're really, really awful for your knees. But even ones I like squats, lunges, even deadlift, we do have to be cautious when we're using those exercises for people who have IT band problems. And so what I usually try to tell them is to kind of back off, go to some of the exercises that we just showed you, try to establish a good positive slope, meaning a few days or maybe a couple of weeks where this knee pain is calmed down. You can start increasing it slowly, increase your resistance or start increasing the repetitions by maybe 10 to 15% a week. And when you've done that a few weeks in a row and things are feeling good, you're starting to feel confident, then you can add back the lunges and squats and deadlift. Just be really careful with it because that's probably why you've had the problem to begin with. All right, another thing to do is to look at your shoes. If you're a runner, definitely got to pay attention to those shoes and how many miles they've gone on it. If they have over 300 miles on it, they probably need to be switched out. For us everyday individuals, you want to make sure that the wear pattern on the shoe looks pretty good. If it starts kind of wearing on the lateral edge of it, you're probably loading on that side too much, and that's often where the weakness is at. So therefore, it may be time also to change your shoe out because the shoe may be lacking its stability and its protection from that lateral loading position, and that's what's helping to overload the IT band. So you may time to switch those out. In our office, we treat these things day in, day out. I really love treating overuse injuries. They're a lot of fun, actually. And a couple of the tools that we use frequently that I'm going to want to introduce to you, one is called active release technique. So this is a soft tissue technique that's designed to break up scar tissue and help reestablish normal biomechanics at the hip and the knee. It's a great technique. We've used it for years. I've been certified in it now for almost 17 years. It is a fantastic technique, and it really does work well for getting that athlete back onto their training path as quickly as possible. On occasion, when that doesn't quite do it, or doesn't really make the pain go away as quick as we want, we'll also throw in some acupuncture and dry needling. Of course, that's been around for 3,000 years, right? But it's a great technique that helps the brain to kind of reestablish what is pain and what's not pain. It helps to kind of, again, change the neurochemistry of how our brain senses this pain problem that's coming from an area of the body. And so acupuncture dry needling is a very effective tool, particularly when you couple it with a soft tissue technique, a retraining program, and some training modification. So I hope all these tips have been helpful for you. Again, we're here to help you as much as we possibly can. Feel free to reach out to us on our website, our Facebook page, our Instagram page. You can even email me directly, drrich@coreroanoke.com. We are here to help you feel better and be healthier than you've ever been. I hope you have a great day. Take care.